Hello to all of my guests tuning in. This is your host, I am Lovely Ann, and welcome to episode 2 of the Pulsating Thoughts podcast, where we are having today's segment on women's health. Today, I have my special guest with me, Dr. Jamell Walker. Welcome.
Hello, good morning.
Good morning. Where she is a board certified obstetrics and gynecologist, where she is going to be giving us some basic education on women's health. So thank you so much for being here this morning. I'm so happy to have
Absolutely. Thank you for having me.
not a problem, not a problem. So we're going to do an icebreaker before we get started. And I want to
Oh, Lord,
share
here we
with
go.
you. I want to share with you my very first fond memory of you. So I
Mm,
remember sitting in the office one day, and we were all notified that we're going to have this doctor start with us. Going to have this doctor. It was a female doctor. No names was really thrown around, just a female. So I'm like, okay. I remember getting this call one time working on some cases, and I remember getting this call, and it was from one of the girls in the OR. Apparently, you had just did a walkthrough down in the OR, and she was like, "Have you met your new doctor?" I'm like, "No, I haven't met her yet." And she was like, "Oh, I think she's gonna be this and that." Negative connotation. However, when I first met you, it was different. I got a different energy from you. So I remember Kim telling me to come upstairs to meet you or what have you. And then when we first met, your very first introduction to me was, "Hello, I'm Jamell." And for me, for people who don't know that setting with physicians, that could be a lot
mm,
of egos and personalities, right? And you just presented yourself just as Jamell, not Dr. Walker or throwing your weight around. And then we just started having a conversation and you just started releasing some stuff. And in my head, everything that people were quote unquote saying, I was like, this is totally contradictory to the energy that I'm getting. And I was like, she's cool. She's cool. I was like, I don't get, but whatever. I won't say too much about what we talked about because that is going to be shared on the back end. But I just want to say people shouldn't
absolutely.
judge a book by its cover. Don't judge a book by its cover because oftentimes the assumption, the preconceived notion that is made is typically the wrong one. So,
Absolutely. But my cover is okay too.
I love your cover. I love your cover. So, just for the viewers, go ahead and give people background on your education level. For the trolls who possibly want to come and say X, Y, and Z, give people some educate background on your education.
Absolutely. My name is Dr. Jamel Walker. I am a board certified obstetrician and gynecologist. What can I tell you? I did my undergraduate degree at Stanford University. I was not done there. I decided I would go get a master's in public health or SCM from Harvard School of Public Health and Health and Social Behavior. Did a lot of research on doctor patient relationships and conversations, which is what I attribute a lot of my humbleness to.
Hmm.
It was very important lesson for me to learn before I became a physician. I think it made a huge difference.
Gotcha.
And after I graduated from Harvard, I decided that I wanted to be a doctor. I think I've always wanted to be a doctor. I just thought it would be too hard. And life circumstances present themselves in such a way that you realize that you can do anything, right?
Right.
My mom was a lung transplant recipient. And every day, the little medical students, I call them little medical students, the medical students came in every morning and were like, "Good morning, Miss Walker, da 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 da," and this and that and the other. And I looked at my mother and I said, "Oh, I can do this.
Right. Right.
If they can do this, I can do this." And so I started making sure I had my pre med requirements. And I ultimately graduated from Southern Illinois University. It was a circuitous path because, when you're a little bit older, you make decisions. I taught at a university for a while. When
Mhm.
my mom was homesick, I wanted to make sure I spent that quality time.
Right.
And ultimately, when I graduated, I went to Tulane University for my residency in obstetrics and gynecology and graduated and got my first job in Tallahassee, Florida. Um,
Ah,
that was an amazing experience, fresh out from New Orleans to Tallahassee. It was dynamic, it was a change. And my then husband at the time had followed me so many times. I was just like, "Hey, Where do you want to go now? He's like, we're going to Miami. And ultimately, that's where you and I met here.
Yep.
I've
Down
been
in
now
Miami.
in Miami since 2013, which is hard for me to believe. So I've been here 11 years.
Wow. Wow. So question, was obstetrics and gynecology your first choice?
It was my absolute last choice. um, I went to medical school genuinely thinking, I know it's crazy. I went into medical school and residency going, hey, I mean, before residency in medical schools, thinking I was going to do orthopedic pediatrics. I was going to, I'm a handy woman at heart. I own all these tools. It's perfect. Went on the rotation and hated it. It was not me. And so you, as medical students, use medical school as a time to figure out who your people are and where you fit in best. I was on my OB rotation for literally 10 minutes and I delivered a baby. And I was like, oh my God, this is amazing. I just help bring life into the world, right? They do it on their own. We just assist, right? Or at least that's how it should be. And then I found out I got to cut people open. And you know me, I love to cut people open. That is one of my favorite things to do. I love to do surgery. I love to open the body and see how all the amazing things that God has put together come together. And when they are misshapen or malformed or out of whack, we put them back together the best that we can. And I love that. That is like my passion. And I love to sit at the robot and do that. And I also get to help women at all these different stages in their lives, right? When they have their first period, their first sexual experience, their first baby, and then they're like, oh my God, my second baby, and that third and that fourth baby. And talking about birth control and contraception, talking about the changes in our bodies, perimenopause, menopause, and then ultimately being healthy, happy 60, 70, 80-year-old women, and hopefully sexually active women, and helping to maintain that. That is what I do in a nutshell.
All right. This episode could not have come at a perfect timing when in the news of social media, we've just learned about the untimely death of Jessica Pettway. Um,
Yes.
we had this episode planned prior to her passing, but the timing just was perfect where she passed away from a misdiagnosis of she was misdiagnosed with fibroids. In actuality, it was actually cervical cancer. So, with my experience in obstetrics and gynecology, I go back 20 years. I've always been in that. There's
Mm-hmm.
levels to cancer, and we can deductively conclude. I want to put that out there because it is obvious that you were not the doctor treating her, but
I was not treating her, and I'm not aware of any specifics in her case.
yeah, just want to put that out there for the folks.
First and foremost,
So
and
we
prayers for her family, her
for her
children, her
family, her
husband.
children, her husband, everybody who's affected by her loss, the loss of
Yes.
her life. But we can deductively conclude that somebody dropped the ball in regards to her health care because cervical cancer and fibroids is two separate entities. Correct me if I'm wrong.
Completely different diagnoses. And I don't know if she was aware of another diagnosis or if that was the diagnosis she gave herself or if a doctor gave her that diagnosis. I can't tell you that, not having looked at her records or any type of anything about her case. But what I can tell you is that fibroids are completely different than cervical cancer. We can have bleeding caused by fibroids
Mhm.
and confuse it with other things, but cervical cancer is a very separate diagnosis.
It's totally separate. And it takes time for cervical cancer to develop, which goes into my very first question with you. Oh, you know what? Let me back up. There's
Okay.
a narrative that I've been seeing on social media, primarily from African American women, that they feel as if oftentimes they are not heard by gynecologists, where we can say that gynecology is a specialty that is oftentimes dominated by men.
It
There's
is,
it's not a lot of representation of women, and then there's not a lot of representation
let
of
alone women of color.
correct. I was just about to say that, let alone a women of color. So oftentimes women feel as if they're not heard by their gynecologist. And I can tell you from experience, the conversations women have confided in me to say that, hey, this doctor makes me feel X, Y, and Z. And we're talking about 20 years. I'm not pointing out any doctor in particular. I've worked with an Asian doctor, gynecologist. I've worked with Indian. I've worked with Jewish. I've worked with white, Caucasian men and women. And you're the first Black gynecologist that I've ever worked with. And only two of them
Woman.
Black woman, and only two of them being female, and you're one of them. So, the question is, do you feel over the years, with your personal experience, that Black women get not so adequate health care as opposed to other nationalities?
That's a beautiful question. I think that this has been proven over and over and over again. I think the underrepresentation of minority Black and brown doctors is apparent. We're going to have a doctor shortage shortly. I think COVID elucidated some of the things and problems in medicine, and people took good exit strategies and said, I'm not going to do this anymore. It's too hard. There's a more humane way to do medicine. I think that it has always been curious to me that a woman would go to a male gynecologist or obstetrician. It's hard for me to say, well, when your period, how do you feel? How did that feel for you? What was your experience? When you orgasm, all of these things, when you had your first baby, what was labor like? What was your C-section like? What was your vaginal delivery like? All of those things are questions that I have firsthand knowledge and experience. They may not be your experience, but I can lend to you my experience.
Correct.
As a gynecologist, I literally try every device before I give it to a patient, right? I make sure that it's something I know what's going on and the toleration, and I know my pain threshold, and I can say, look, if you don't have a high pain threshold, this is probably not a good way to do this. Let's do it under anesthesia. Let's do it under, pain management in the office. You don't have to just do it free, hard, and cold anymore. There are a lot of doctors that do things like that. As women, we have to advocate for ourselves.
Correct.
Look at these reviews. These reviews tell you a lot. I don't look at my reviews anymore because I take it personal. And you know me, what did my office manager say? You have 5,000 reviews and you only care about the 2 negative ones. I said, yes, because they had a negative experience and that's not what I want for them. Right? If you come to my office and you pay your copay, you're going to get my show. I'm going to give you the love and attention and education that you deserve, the care that you deserve as a patient. And I guarantee that there are a lot of patients who don't get that elsewhere and they're not used to that. No. And that is unfortunate. And so when they come in and see me, they're like, what are you talking about? My doctor never told me this. They never told me I had that. And I said, these are things in your medical record. It is my obligation as a physician to tell you, educate you, and you and I make joint decisions in your care. Right? If I can't do that, then that is not my job. I need to find something else to
do. Right.
But in the interim, I want you to realize that when you walk into these institutions, you are walking into face physicians who have their own personal biases, and they don't always check their biases at the door. Right. And so you may be in a place where your care is not important to them. Right? And they maltreat you. And you look at the pain surveys and how Black and brown women are not given pain medicine compared to their white counterparts. We have to do better.
Correct.
We have to do better.
I recall over the years, again, I just want to clarify that over the years, working with these different nationalities of physicians, I've even witnessed, because gynecology is one of those specialties that requires a chaperone. Okay, so these doctors are not going in the room solo. And I have seen women complain about, whether it be Caucasian, Latin, whatever, complain about issues, and they're handled with a different level of care and attentiveness, as opposed to, I've witnessed Black women complain about the same issue, and it's just kind of like, just
brushed off.
It's brushed off, and it's not handled with the same level of care. So this is it's an issue in our community. And I hope, with time, things will evolve. you know,
But you get to choose your doctor. That is the beauty of healthcare, right? You have this panel of doctors when you get insurance, and you can say, no, I didn't like you. I'm going to go somewhere else. You are an advocate for yourself. And by all means, if you don't like me, I am not for everyone.
correct.
Right? But if you don't like me, please go find someone that you like and you can trust, because I need you to trust me. Even if you don't like me, I need you to trust that I'm going to do what is best for your health care. Right? I do my best to check my biases at the door. And when I encounter patients that are racist towards me and they
Mhm.
say, no, 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 go get the Spanish doctor. I say, there is no Spanish doctor. I'm it. You want to wait? She goes, I waited 3 months for this appointment. I said, well, you're going to wait longer than that because I'm the only one here. I'm happy to help you. What can I do for you, mommy? Right?
Right.
And I
Right.
treat everybody, and you know this, Lori, I treat
Right.
everybody with love and respect and kindness. I try and make sure they know that I'm going to do the best. Now, I don't stand for nonsense. You know that too.
I know that. I know that.
But I make sure that you're going to get the best health care. That is my job. It is also your job to make sure that you are getting it from a person that you trust.
All right. Awesome. So let's move right along with our questions. We're gonna start with
Okay, let's do it.
let's do it. So we're gonna start with HPV, because we understand that HPV is a virus that can cause cervical cancer. So just share some basic knowledge on the HPV virus. How do patients contract the HPV, and how,
Mhm.
if it is not treated, what it can possibly evolve to?
I love your loaded questions. Let me start at the beginning. All right. So, human papillomavirus is, as she said, the virus that we believe causes cervical cancer. We know that. And so, that is why when children are between the ages of 12 and 14, we encourage them, hopefully before they've had sexual intercourse, to get the vaccine, right? Gardasil. It is the only vaccine out which prevents cervical cancer. We encourage people to get it. Not everybody does that, right? And because they don't do that, they're putting themselves at risk. I tell my young ladies, boys have the virus, they give it to us, or we give it to them, and we keep sharing, especially if we're not using protective barrier methods when we have intercourse. So, as Lori said, cervical cancer is slow going. I wish I had a little diagram because I draw this. There's
Yes, I
normal on this side and frank cancer on this side, right? And there's stages in between, unless it's an aggressively growing cancer, right? Or subspecies. And so what we say is it usually takes 10 years to get there. That is why they have pushed pap smears out to every 3 years, right? Does that mean you go to your doctor every 3 years? Absolutely not. You still do your annual exam with your gynecologist, right? Because I'm still going to do your breast exam. I'm still going to look in your vagina. I'm going to test you for any sexually transmitted diseases. And I'm just going to check on your mental health, your physical health, and your vaginal health. That is my job, right?
right.
So, cervical cancer, 10 years usually to grow. Normal. The first abnormality is ASCUS, abnormal cells of undetermined significance. They're not cancers, they're not normal, they're just in between. And so we usually test that with the human papillomavirus. If you have the human papillomavirus, we usually do either a colposcopy, which is biopsies of the cervix, depending on your age, or we retest. Okay, there's algorithms that the American Society for Cervical Cancer Prevention puts out. And we follow those guidelines to make sure that we're not doing damage to the cervix at the same time, making sure that these intervals are short enough that we can catch cancers before they become bad.
Awesome.
The
Awesome.
next one is low grade precancerous cells. Then there's high grade precancerous cells. There's carcinoma in situ, which means a couple more cell layers and it's going to be cancer. Our goal with you coming in annually is to catch things on this side,
Correct.
closer to normal than abnormal. So when you avoid your doctors and your appointments and your tests, there's nothing we can do but catch you where you are.
Correct. 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 And I've witnessed so many women who've had abnormal paps and refuse to come back in and follow up as indicated. So that's another that's
And we
another
track them down as best as we can, but it is your autonomy. But at the same time, I tell patients, no news is not good news. You should always follow up your own results because things have a tendency or can fall through the cracks. And you want to make sure that your result is negative. That's why I love all this patient portals now where you can check your own results. And I love it. Patient, Dr. Walker, it was abnormal. I know you're on my schedule. I'm going to talk about it. Nope, we're talking about it right now. All right, that's fine. Let's do it.
so pap smears, you did touch on it briefly. What does this test for? Well, you really did touch on it, but how often? What is the age that a woman should start receiving pap
Beautiful question.
Okay. And what is the age that a woman should stop receiving? Because one of the questions that I think women get misconstrued is once they've had a hysterectomy, that they're no longer required to obtain pap smears. So just give some.
Okay, well, let me answer all 5,000 questions at once.
I'm sorry.
I love Lori. All right, so first, pap smears start at age 21, right? That's what the American Society of Cervical Cancer Prevention has decided. We do pap smears starting at age 21. Now, if you're 21 and you have never had sex or any type of sexual contact, I will not start papping you. That does not make sense, right? But I do encourage you to come into the office and see me so we can talk about your sexual health and all of these other things. We usually pap women until they are 65, okay? And I say until, unless you get a new partner.
Okay.
Right? Because your exposure, we assume that the average age of death in the US is what, 72 point something. So at 65, if we stop, we should be good because they're 10 years growing, right? There's the logic. If you get a new sexual partner at 65, I want you to come see me so I can make sure that your vaginal and cervical health is together. And I have some sexually active 80 and 88-year-olds.
Okay.
And I want them to keep using your vaginas, but they have stable partners.
Right, right.
Or at least for now, right? Now, if you had, and you touched on something very interesting, if you had a hysterectomy for benign reasons, i.e., fibroids, menorrhagia, heavy bleeding, but you didn't have it for precancerous cervical lesions, then you can stop your pap smears. Absolutely.
Okay. Uterine fibroids.
Oh,
Let's
my
touch this briefly.
favorite. Talk to me.
What are
Are you
fibroids?
Black? Yes. Fibroids are the abnormal growth of normal muscular tissue in the uterus. Um, why are they in Black and brown populations? We're genetically predisposed to them. Personal theory: we were bred for our muscular tissue during slavery. It is not surprising to me that we have abnormal growth of muscular tissue. Um, I don't know, personal theory, but we in this Black and brown culture have more fibroids than other.
God, that
Does
was
that
low.
necessitate that you need a hysterectomy? Absolutely not. I tell people if your fibroids are not bothering you, do not bother them. I have a lot of doctors that send patients to me for hysterectomies, and patients are menopausal and having no symptoms from them. Menopause is good for fibroids mostly, right? And usually the hormonal stimulation causes them to shrink. When they shrink and lose their blood supply, they die. Sometimes it can be painful, sometimes it's not, but it depends on your personal experience. Young women, you have fibroids and you're trying to get pregnant, it depends on where they are. If they're not impeding your ability to become pregnant, leave them alone. Right? But if you have so many that we need to remove them, please understand that you cannot carry a pregnancy until a year after surgery. You cannot even try to get pregnant until after a year after surgery. So you have to be careful about what surgical methodologies you undertake to maintain your fertility.
And the surgery you're referencing is myomectomy, correct?
That is a myomectomy. Sorry, Lori, I should have said that. And
No, that's
so
okay.
we do different types of myomectomy. Some of them we do hysteroscopically, which means we stick a camera into your cervix and then we remove them that way. Those are less invasive than the open exploratory laparotomy procedures, where we open your belly and remove them and sew your uterus back.
Got you. Next question. Pelvic pain. Okay,
Ugh,
what can cause
every
pelvic
gynecologist angst.
what can cause cervical I'm sorry, what can cause pelvic pain and what is the common practice to treat it?
Okay, so pelvic pain is my personal least favorite thing to treat.
Mm,
Why? Because I have to figure out what is causing your pelvic pain, right? It could be a gynecologic etiology, it could be a GI issue, it could be a urologic issue. I don't know that until I start eliminating things. And so what I usually do is stop the hormonal stimulation of your ovaries to your uterus. Pelvic pain can be caused by endometriosis, ovarian cysts, ovulation. It can be caused by pelvic adhesions, any of these things. It could also be caused by GI issues, bladder issues. So I try and eliminate all of the gynecologic issues. And if it's not me, I say, not it. And I move you on to another source so we can find the etiology of your pain. If it's me, then I have to go inside and sometimes take a look and figure out what is causing your pain. We start with basic ultrasounds and go from there. If it's ovarian in nature, I shut your ovaries down pharmacologically with medications and see if that relieves your pain. I cannot guarantee that even if I go in surgically, that it will relieve your pain. Because if you have pelvic adhesions, they beget more pelvic adhesions. And so it's kind of one of those things where you're a dog chasing your tail the entire time until you figure out what it is. But usually we catch you.
Awesome. Abnormal uterine bleeding.
Huh, yes.
Oh,
Where do we start?
where?
Everything causes it. Next. Why? Right.
Now, question. At what point, if a woman is experiencing abnormal uterine bleeding, at what point or how long should she wait before she come in to see her doctor?
Oh my gosh, let me start over. That is the perfect question for any gynecologic thing, right? So let me tell you a story. When men die, they die because they don't go to the doctor. A doctor will ask a man, how long have you had this pain? He'll say, what year is it? Right? Women, you ask them, how long have you had this pain? They'll say, it's what hour is it? What, 10 minutes ago? 5 minutes ago? We are usually much better about saying, this is pain. It's not normal. I need to be seen. Right? And when we do that, we catch things early. When we don't, time is not always our friend, especially when it comes to cancers and other things, maintaining our fertility. But with abnormal bleeding, if you are in high school and your periods are painful and you have heavy bleeding, bring your children to me, your teenagers to me. And please don't tell me that I'm putting them on birth control and it gives them permission to have sex, because that is not what I do. That is not my job. That is your job as a parent, right? That is a covenant between mother and child, father and child, family and child. I do not do that. What I do is I can say, I can stop that pain. I can stop her heavy bleeding. And I have medications and devices that help me to do that. You, as an adult, if you're having abnormal bleeding, please don't wait 6-7 months. Come see me. I can fix that, right? That's my job. That's what I do for a living. They're like, oh, my bleeding is so heavy. I didn't want to come in and let you look in my vagina. Baby, that is what I do. That is what I've been trained to do. Bring your vagina. That's what I do. All right. I'll take a look and we do ultrasounds. We figure it out. And there are medications, and that rolls into like birth control pills and things of that nature, and how to mediate bleeding, heavy bleeding. Now, if you continue to have heavy bleeding, we find the etiology. If it's ovarian stimulation, we shut your ovaries down. If it's coming from fallopian tube abnormalities, we can fix those, right? Or remove your tubes. If it's coming from fibroids or ectopic endometrial tissue, which causes endometriosis and pain, we can fix that. That's surgical, right? Or if it's heavy bleeding just because your uterus likes to bleed, and genetically that is what your family does, there are ways to help fix it. Gotcha. I can't fix everything, but I will definitely give it my 100%.
Give it your all. Vaginal discharge. Let's discuss that, because I think women are a little confused about vaginal discharge and the difference between yeast and bacterial infection. So just give some basic education on vaginal discharge and the difference between the two entities of yeast infection and bacterial vaginosis.
Okay, so I always tell patients, and you know this, it is normal to have up to 2 tablespoons of discharge a day. Some women are juicier than others. That is normal. Your vaginal secretions, they smell, they change in consistency based on your diet, your exercise, your water consumption. If you are eating nuts, green leafy vegetables, onions, and garlic, your vaginal secretions will reflect that. Right? And so when you eat things like strawberries and pineapple, my girl Beyonce was like, hey, watermelon, all of those things, they help change the acidity and level of your vaginal secretions and change the taste. They do. And so all of those things chase taste. We want you to be healthy, happy sexual beings, right? And you have to be aware of that. So what you eat before and after makes a difference. All right. Now, when we come to infections, I find that a lot of women are very vaginal discharge hypersensitive. Your vagina is going to discharge. It is going to smell, but as long as it's not foul smelling, if it doesn't smell like fish, which is usually indicative of bacterial vaginosis, which is a bacterial infection, or cottage cheesy like yeast or creamy white discharge. Yeast is a fungi, which is like mushrooms, right? And so all of these things are different and based on the pH level in your vagina. It is a simple swab. Sometimes it's just sticking in a speculum in the vagina. If it smells like BV, we know. It's usually, I can usually be sitting by you on a plane and smell BV. And I'll be like, can I give her a script? And my children are like, if you want that woman a script, I'm going to get you. Right. But I have a hypersensitive nose. I can smell it. It's what I do for a living. So if you're having discharge, don't be afraid to call or come into your doctor's office. Literally, it's a simple swab. We send it off, it comes back, or it's a speculum exam where we look and we take a look.
Gotcha. Next.
Don't be afraid to discharge. It's easy to treat. And if it's physiologic, at least you can breathe and be okay.
My next question, menopause. I'm in my 40s now, and each stage
Barely.
of life is different. So, a lot of women, this is the stage of life that we hate. Okay. So, what is menopause? What is the common age that women starts to experience perimenopausal symptoms? And how can they currently treat it?
Okay, so what is menopause? Definition. The definition of menopause is the absence of menstrual periods for 12 consecutive months, 1 year. Okay, so the average age of menopause in the US is 51.2, I believe. And so that being said, there are outliers on either edge. There's some women who go into menopause in their 40s, some women, like my mother and grandmother, who went into the menopause in their 60s, which I find irresponsible and ridiculous. Right? And so we fix that. And so, what are some of the symptomatologies that go along with that? Hot flashes, night sweats, irritability, mood swings, irregular sleep patterns, menstrual irregularity, sometimes changes in memory. All of these things are part of our normal aging process. So you come to me and you say, Doctor, fix it. I am hot flashing. I had the AC on, then the heat, AC, heat, AC, heat. My children can't stand me. I'm like, is it hot in here? They're like, you're the only one hot in here. I was like, oh, thank you. That's not what we meant. Right? But you have to find humor in it because sometimes it's not cute when you're the only person sweating bullets in a room. Right? And so there are lots of interventions, right? There's hormone replacement therapy. There is exercise, mood enhancers, acupuncture. And there's some soy products, and now there's good products now that are non-hormonally based for those of us who've had breast cancer and don't want more hormones. All of these things are available, and do not suffer. Come in. There are some SSRIs, which are some antidepressants that help. Come. There's room. We can make it work and fix it. Your husbands will thank me. Your children will thank me. You will be happier. You
All
won't go
right.
to jail.
Healthy pregnancies. Um,
That is all we want, Ashe.
what is considered a healthy pregnancy? My loaded question.
Very
For
loaded.
new moms, at what stage should a woman come in for her confirmation of pregnancy and her first obstetrical visit?
Okay, that is a great question. What is a normal pregnancy? For me, a normal pregnancy is anyone where I get the baby out and baby and mom are healthy and do well. That is a normal, healthy pregnancy for me. I tell people, they're like, oh my God, you're an obstetrician. You bring life into the world. I do, Lori, you know this. I do not take that role lightly. I take it very seriously. And obstetrics is either very happy or very sad. There are no in-betweens, right?
Yeah.
It's either happy medicine or horrible medicine. And I prefer happy medicine every day. So we ask that you come in for your first pregnancy visit, usually between 8 to 10 weeks, right? So a lot of you call and you're like, I just missed my period. And we're like, let's wait. Why do we have you wait? We
Right.
have you wait because most women miscarry at less than 12 weeks. And we don't want to put you through all of that. That being said, I would rather you come in so I can get a good dating ultrasound, right? The earlier we ultrasound you, the better it is and more accurate in terms of dating your pregnancy and how close it is to your last menstrual period. If you're good with keeping up with your menstrual cycle, great. I love it. That makes it easy for me. If you're not, we do a dating ultrasound to help us with that. What else do
Is
you want to know? I want you to take your prenatal vitamins before you get pregnant and your folic acid. I want you to make sure you maintain all of your appointments to maintain a healthy pregnancy. I want you to drink a gallon of water a day. I know it sounds like a lot because you're already peeing every 3 minutes, but I want you to drink a gallon of water because your uterus is a muscle. And if it becomes dehydrated, it contracts. And I don't want you contracting till you're ready to deliver. I want you to have sex during your pregnancy, but I don't want you hanging from a chandelier, right? There are certain things, whatever, I tell my patients, sex during pregnancy, you like it, I love it,
right.
right? No
Right.
hanging from a chandelier because it's a risk for my baby and it's my baby until you have it.
Right. Right. Right.
Right? I take that seriously. I'm going to test you for every sexually transmitted disease: gonorrhea, chlamydia, syphilis, HIV, hepatitis B, and hepatitis C. Why? So that if you have any of those things, I can decrease your risk of vertically transmitting it to my baby because it's my baby until you have it. Right? And if you have it, we can help prepare during this pregnancy so that we know what we're going to do during delivery. Right? And give you appropriate medications if prophylaxis is required. We also talk about eating certain foods, right? No high fatty fish, no raw fish, no rare steaks, no raw conch, no raw ceviche, right? My Latina sisters down here specifically like queso blanco, which is unpasteurized. I say, Mama, no, no. Every dairy product you eat must be pasteurized, right? They say I can't eat sandwich meat. You can eat sandwich meat, but it's that juice at the bottom that causes problems. So I want you to warm your sandwich meat so that we can kill that bacteria and make sure you're draining it. Um, Exercise during pregnancy, important, right? I want you walking 30 continuous minutes a day because I know I have to say continuous because y'all will be like, I walked 30 total minutes today. That is not what I meant, right? I don't want you doing parkour, CrossFit, heavy weightlifting, riding a bicycle. Your center of gravity is off, right? Unless you do those things already. If you are a marathon runner and you are pregnant, by all means, continue doing what you do because that is your level of fitness. But now, pregnancy is not the time to start doing those things.
Correct.
Okay.
Correct.
Lori, what did I miss?
Nothing. You pretty
Sex,
much.
sexually transmitted disease. Oh, you are not eating for two. You are eating for one, right? I know everybody down here loves to eat for two. You get an extra 300 kilocalories a day. That's it. Because I am a perfect witness that weight is hard to get off. And you must maintain. That's why I tell you to walk 30 minutes a day. All of those things are things that help contribute to a healthy, happy pregnancy. But most importantly, maintaining your visits and seeing the doctor. Because we're going to do all these interventions and making sure that you're doing the things we need to do.
Last but not least, before we move on to our next part, breast exams. There's so many women out here that do not know how to examine their breast. So if you can just give a good depiction on how a
You
woman
want me
can
to show you and do it, or what are we doing?
show, for those who are visual, there's some people that are auditory and visual. So if you can just show how a woman should properly examine her breasts, please do so.
Okay, so right now there's a debate in the obstetric and gynecologic community about self breast exams. Excuse me. I know for a while we were not teaching patients how to do these. I have never stopped. I think that it's important that you get to know your breast tissue because I see you once a year, but you can check your breast once a month and let me know when something is abnormal and or different, right? That is the job and the covenant that we create, right? I teach my patients how to do a breast exam. soapy fingers in the shower. You can do a circular method around the breast. I don't know if you want to see my breasts. These are new. Um, and go around in the circular method and get to know your breast tissue, but also go under your flabby arm, my flabby arm, as I just showed you, and make sure that you check for any tissue there or lumps or bumps, because that is also the tail end of your breast tissue, goes under your arm. Okay. So what are you looking for? And this is exactly how I tell my patients. If you find a lump that moves, that doesn't move, that's painful or not painful, you're going to call me. If you notice that you have nipple discharge unrelated to stimulating them or breastfeeding, you're going to call me. If you notice that your nipples point in rather than out, or your skin is dimpled or tethered or puckered in, you're going to call me. Or if you notice your skin is dimpled like an orange, you're going to,
Call me.
Lori, what are you going to do?
Call.
That's right. You're going to call me. Anything weird or unusual, I would rather you call me and let me do an exam or get an ultrasound and go into a diagnostic mammogram. And please, by all means, get your screening mammograms every year. I would start at age 35 in my patients. Um, Black and brown women, please make sure you're getting your colonoscopy starting at age 45. Um, the earlier the better. All of those things are important. Um, I'm a perfect example of not skipping your mammograms. It's important. Make sure you do these things. Let us know. And always check your breasts a week after your menstrual cycles if you're still menstruating, because that's when your breasts are the least lumpy. Decrease your caffeine because they can make your breast lumpy. And also, if you're not menstruating and not having periods, I say do it on your birthday, the day of your birth. So the 22nd of every month, I check my breasts. That's my present to myself.
Right. So I want to move on to the next part of this. Now,
The hard part.
the hard part. But this is, I think this is something that people need to hear because doctors are people too. Um, you went from well, I'll say it this way. There's Dr. Walker, and then now you have Jamell Walker that is on the other side of the tracks now. And you spent so many years educating women about their bodies until now you're encountering your own issues. So I want you to share your story of being a breast cancer survivor. Share your story on how you were diagnosed, you know, how was that for you? Life, chemotherapy. And yeah, just share that because I think that is important
Of
for people
course.
to know.
Okay, so first of all, get your mammograms every year. If I have not impressed you to do that, please, please, please do that. I'm a perfect example of someone who ignored signs. I was so busy taking care of my children and other people's children and women that I neglected myself. We are humans too. We have to maintain all of our health screenings as well. It turned out I look back and I had missed my mammograms for almost 3 years. So what happened? I was sitting in my office and my mother's deceased. I heard her say, "Get a mammogram today." I was like, "That's weird." Today? Gwen Walker? Okay. So I go and I get a mammogram. My breasts are usually lumpy. She had fibrocystic disease. I expect them to say, "Hey, we're going to do an ultrasound." So when they say, "Hey, Dr. Walker, we're going to go ahead and do an ultrasound and we're going to go with that." I was like, "Okay, pretty normal." Da, da, da. My kids are there. I'm driving me nuts. We're doing it simultaneously. And the radiologist comes in. He's like, "Hey, don't be surprised if you get a call because I found some things." I go, "Oh, they always find some things. It's okay." But I think he was trying to subtly tell me that he saw something.
Mm.
But he didn't communicate. And of course, I was too busy to give him a chance to talk. Monday morning, I go into the office like I always do, 6:30, and I'm going through labs before the girls come into the office. Going through labs, and I was like, "Oh, damn, I got to tell somebody they have cancer, breast cancer." Because of course I ordered my own mammogram because I'm a doctor and that's what we do.
Right.
And I was like, I look up at the name and I was like, "Oh shit, it's me." Damn. The reality of that was overwhelming. I call my work, I call him my work husband, Dr. Pierre. And I said, "Dr. Pierre," I was like, "I am reading this uh, mammogram and it says that I have breast cancer. He goes, no, Shadi, you do not have breast cancer. Because he's Haitian and all of his luster. And I was like, oh, I think you need to come because I'm losing my mind. And he comes over and he's like, okay. So I call the center where I send everybody. And my patients will tell you that I say, you are done using them, cut them off. You can get new ones. I say that to every patient. But it is your decision. When you ask me what I would do, that is what I would do. So I call the girls and I was like, hey, in that sing-songy voice, can you set me up? Can you set up a patient for some biopsies on Friday? And they're like, oh my God, Dr. Walker, Friday is booked. We have 6, 7 patients, da, 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 da. I was like, look, I go, if I have to cancel patients on a Monday through Thursday, I'm canceling 30 or 40 people, but I only have 2 or 3 surgeries on Friday. I can move them. They're wait, Dr. Walker, it's you? I was like, yeah. They're like, we'll move everybody. Be here Friday morning. We'll do it. And when I arrived for the biopsies, I met the doctor. Everybody was beautiful. They were like, hey, Dr. Walker, my God, it's nice to finally meet you in person. Blah, 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 blah. By the time they were done with my biopsies, it was, Dr. Walker, you're going to be okay. Everything's going to be all right. And I was like, oh, I have cancer. And I turned to the doctor and I said, hey, in your experience, I know you haven't sent these cells anywhere. She goes, it's cancer. And I was like, okay. I was going through a divorce at the time. This was December 2019. So, like a month or two before the whole COVID thing started. I was ultimately diagnosed, what was it, January 15th? I started chemotherapy on January 28th, 2020. And went through that experience. My first chemo appointment, my sister and my best friend went to. They got me through it. My second one, my ex-husband took me to. And the rest of my chemotherapies I went through during COVID by myself with the other patients in their rooms. And COVID was rough. And so I cannot imagine how much different it would have been had I done chemotherapy with the support of family and friends in the hospital. But I am lucky that God loves me and I'm strong. And it was horrible, but it was not intolerable. It was survivable, the process. Things happened, the port blew, you had to have a port put in, and all these things kept happening. Oh, you can't have chemo today, because I was one of those people where it's like, I want my chemo every time I'm supposed to get it because I don't want to get off schedule. I'm very type A and I don't have time for you people to mess around. I need my chemo. Right. And they're like, Dr. Walker, you are projectile vomiting everywhere. What would you like us to do? Give me some Vofran and let's go. Yeah. Right. It was hard, and the constipation was debilitating. All of it was horrible. And then my hair started falling out. And the fear I saw in my daughter's eyes. And I finally asked my ex-husband, we were divorcing at the time. So I asked him, I said, will you just shave my head? He shaved my head. And when I came out, my daughter was like, who are you? What happened to my mom? And the gut punch that served. And now I wear these wigs with a badge of honor. And she's like, wear your natural hair. I was like, girl, I'm still not that girl. Your hair is your crown. It's your personality. It's who you are. You know that. And so learning how to survive that. And then I went through infections with the dilators in my breast. I can't even think of the word right now. But I got infected. They took them in. They put them back. They took them out. They put them in. They took them out. They put them in. I finally was like, I don't want them. Leave them. And I went with just saggy skin for about 6 months. And then he did the first implants. And I had so much tissue that my implants would flip. And so I wake up and my breast would be flat because it would be the back side of the implant. And it was a game. My daughter and I would just flip them. We flip them. I was like, it's okay, we'll flip them. And so I finally was like, this is not right. I cannot do this. And I went back and I said, I need you to fix this, make it stop. And I did lose my nipples during the process, which was fine. I had extensive disease. They had to go. Like I tell my patients, you can buy new ones. And my sister said, "You did all this to get new boobs?" She goes, "You're the only person I know who got cancer to get new boobs." I said, I hadn't thought about it like that. But I did get new boobs and a tummy tuck out of the deal. And ultimately, I did get bigger implants and I got 3D nipple tattoos. It was an ordeal. I am now, gosh, it is coming up on 2024. So in July 2024, I will be a 4-year cancer survivor. My numbers look good. I feel good. I don't think breast cancer is ever going to bother me again. I expect to live, usually they say if you live 20 years, it'll come back. I expect to live that long, and I'm going to fight and continue to thrive.
Wow. Wow. Now, did you lose what happened to you professionally as far as work? Because obviously you couldn't work. Obviously.
It was COVID, so everybody was doing telemedicine, but people were working in the hospital, and so I was immunosuppressed due to the chemo. And my oncologist was like, "You may not work." So for 2 years, I was at home with my kids. They were stuck in compound Jamell with me. They are still mad about missing 2 years of in-person school. I think it was the best decision I made for my health and for my children. But when I was on these breast cancer physician websites, everybody was talking about, I lost my position as chair. I lost my job. And I was like, oh my God, they would never do that to me. And I don't know if it happens because people are afraid that disease will come back or you'll get sick, or you just decide that you don't want to grind like that anymore. But work changes, life changes.
Right, right.
And so I ultimately, my boss was really supportive when I was diagnosed. They're like, hey, when you come back, you can do this, you can do that, do this, do that. And then he retired while I was out. And, and so when I came back, I was working 45 minutes from my home and I had to commute every day. And it was rough. And being an obstetrician, you cannot be that far from babies. So it created a new dynamic in my life. And I was like, I do not want to do this that way.
Listen, I remember the days, the drive for you and how you felt exhausting, being exhausted, and just there's a lot that was going on behind the scenes that people
But
don't.
my Audible account is out of control. I have listened to so many books.
So it didn't stop there for you because
No, because that's how we met. I came back to work.
you came back to work, and that's how we met. You had just came back to work. They put you where I was, and the practice took off. I mean, in less than a couple of months, you had a schedule that was kind of booked out, like 4+ months for people to come in and see you. We had patients that was driving, if people understood the commute as to where you live and where you were located. That is a big, huge gap driving through South Florida. So people was driving 45 minutes to an hour plus when they found out that you were back practicing. So, and things were good. Things were on the up
I'm
and up.
very blessed.
And then
Yeah.
life happened.
Patients are loyal.
Patients are very loyal,
Again,
especially in the gynecologic space. Patients are loyal. You find a good doctor, I'm going to stick with her. I'm going to travel wherever she goes. And that was the case with you. But then life happens again. Boom. They
it
come
did.
and shut everything down. And then in addition to your divorce had just finalized, we was given a window as to when that final date was going to be. And then you
It's
decided to
true.
have a procedure that's a common procedure that went terribly
Relatively minor procedure, but there's no such thing.
wrong. But it
So,
went.
what did I do? I scheduled a surgery on November 16th. It was supposed to be minor enough that I didn't bother my little sister with the details or my best friend. I was just going to do it and be in and be out. I had a ride home. I Ubered to the hospital because, again, no big deal. I know the doctors, I know the hospital, I know the staff, all of it. Um, this is where things get a little cloudy, right? Because I went in on November 16th, but I didn't wake up till December 13th.
Mm,
And My sister was like, do you know what happened? And I was like, yes. And she's like, what do you think happened? I was like, well, I could barely speak, but it was like car accident. Is Dr. Ahmed okay? And she said, Dr. Ahmed is fine. I was like, no, she picked me up and we had to have been in a car accident. She goes, Jamell, you've been in the ICU for almost a month. You had postoperative complications and almost died. And I was like, what? I could not walk well. I could not walk. I could not talk well. I could not hold my phone. I could not use my phone. It was a mess. Yeah, my life changed dramatically again. And what I remember and what I thought and what I remember hearing my sister say, you effing fight. These children didn't ask to be here and they need you to be here to take care of them. You fight. And I was like, I don't know what I'm fighting for, but I need to fight. And she said there were many a times when what her not her she said she has a specific memory of a infectious disease doctor who came in and was and my sister's a lawyer, so she's very type A. Everything is cut and dry. It is black and white. There are no in betweens. That is how she functions. She's not quite that way all the time, but she said he told her, when I see patients like this, I give them 24 hours. And my sister sent out this infamous text message to family and friends. It was like, if you want to see Jamell alive, you have 12 hours to get here. And it caused a cascade of emotions. Family and friends start flying in, apparently, to see me. And those pictures are horrible. I apparently had 21 liters of fluid on my body. I had received 7 pints of blood. I had had an open surgery. I had developed abdominal compartment syndrome, which is something we read about in medical school and never see. They had to leave me open, do a delayed closure. I had a pouch that blew. I became septic. Just got pneumonia. Just one thing after the other. Delayed closure. It was a lot to wake up to, and I was just lucky to be alive.
We were freaking out. Okay. Because we knew that it was supposed to be something simple, and we're all texting, hey, you okay? Hey, and then days go by, weeks go by, no response, which is so unlike you. So we were freaking out. I mean, and we were asking this one, like, we want to violate some HIPAA to really see.
But you didn't, and I appreciate that.
Yeah, she didn't. She didn't. But like it was just that scary for us. Like we really wanted, because we just wanted to know, if were you okay? Were you alive? Were you deceased? We didn't know. We didn't know anything. So it was really, really scary. And I believe it was Bree who got a text from your sister to kind of give us that clarification that you were okay, but you wasn't out of the works, you still had work to be done, but it was really scary. It was really, really scary.
Yeah.
Um,
And my sister sat by my bedside every day. And Dr. Ahmed and Dr. Pierre and Mortimer and Jameson and Sonia, all of these people who stood by me and loved me and guided me back, I'm grateful to forever.
Grateful, grateful. So
Oh,
I'm gonna say this.
and Carol, who rubbed my feet every day.
So my
I
final
heard my
question.
surgeon even rub my feet because I was like, I had developed a foot fetish apparently when I woke up, and all I could say, I was like, rub my feet.
So my final question to
So
you.
people would bring cream and rub my feet.
So after everything we're talking
Everything.
about, from you know becoming a doctor, you're a mom, you're a wife, you know, um, you have your own health issues with breast cancer. You survived it, you beat it, the divorce, the
Mhm.
losing your practice, all of that. Finish this sentence for me. My name,
Okay,
well,
go.
before I ask the question, I would say, with that experience, you definitely have to have a new perspective on life. and how you view and go
Without
about.
question.
So finish this question. My name is Dr. Jamell Walker, and I'm.
Oh, who am I? I'm Dr. Jamel Walker, and like I always say, I am amazing. If you know me, that is what I always say. How are you? I'm amazing. And people are like, I'm trying to get like you. As I get there, it's amazing. Get here, right? My perspective on life has changed dramatically. My children and my family have always been first, but they are super, super first now.
Oh yeah.
I will never grind like I did before, ever, for someone else. Um, but I always grind for my patients. You know that. So
Right.
I am Jamel Walker. I am amazing. I'm a mom. I'm a fur mom. I'm a sister. I'm a best friend. I'm a lover. I'm a single girl back on them streets. What else? I'm a doctor. Um, did I say I'm a fur mom? I know,
Yes.
Lori, you know me. Um, I am the chick that hangs out in Home Depot and learns everything and then comes home and tries to do it herself. Who else am I? I'm a wine connoisseur.
Mm,
I love to read. I love to swim. I love to relax. And I appreciate the fact that I am here every single minute of every single day. That's who I am.
awesome. Awesome, awesome. So I won't take up no more of your time. I thank you so much for taking out time out of your busy schedule to come and do this segment
Thank
on
you for
Women's
having
Health.
me.
I surely should appreciate it. I hope that any woman who watches this episode definitely walk away with a greater understanding about their body. Yes, if there's anything, if you're having any issues, if there's something that hit you, please make sure you go see your doctor at your earliest convenience. Please make sure that you like this video, subscribe. If you want to donate to our channel, just go visit www.pulsatingthoughts.com and donate to help this channel grow. In the meantime, I am Lovely Ann, and I'm signing out. Thank you so much. You have a great day, Dr. Walker. Okay.